The doctor's in, and today's topic is generic versus brand name drugs. If you have a prescription filled recently, there's a pretty good chance that you were asked, do you want the generic form of that? And you may be wondering, is it safe? Is it as good as the name brand version? Well, Dr. Scott Ackerman is one of the First Coast's leading doctors. He is here today to break all of that down, the differences between generic and brand name. So let's dive right into it, because I was just at the pharmacy the other day and they asked me that question, and I kind of went for the cheaper option, but I didn't know if it was the better option.
Right.
So how are generic drugs the same as brand name drugs? Are they the same?
Well, they're not the same.
Okay.
They're the same. They have the same active ingredients. So the FDA requires generic drug manufacturers to manufacture generic drugs and meet the same standards as the brand name drug. You could trust the generic drug to have the same active ingredient. You could trust it to have equal quality and safety and effectiveness of that active ingredient. That's what the FDA mandates for these generic drugs.
Okay, so then how do they differ, the generics from the brand names then?
Well, they may look different. The FDA allows them to look different. They allow them to have different inactive ingredients. So these inactive ingredients, the binders, the flavoring, the colors of them might be different. The packaging of the generic drugs are different, of course, and the labeling. But all of the binders and inactive ingredients are all approved by the FDA. Sometimes these inactive ingredients, however, even though they're inactive, they may change the absorption rate of the active ingredients in the drug and could cause different levels of that drug to be in the body depending on an individual person's ability to absorb the drug and the way they react to these inactive ingredients.
So then the million-dollar question is, why are they so much cheaper than the brand name drugs, and sometimes significantly so?
Well, when drug companies make drugs, the direct manufacturing costs are just a small part of their cost of developing, or the cost of the drug. For a drug to come to market, the to invent it. They have to figure out that this drug might work. Then they have to test it. It has to go through clinical trials and testing and all sorts of research. A lot of money is then spent on educating physicians and healthcare practitioners. That's their marketing costs, if you will, or advertising costs to make people aware of it. And the FDA tries to balance the interests of the pharmacological companies with the efforts to lower patients' medical costs. You know, we as society want to encourage drug companies to do this sort of research, and they should be able to recoup their cost of research and make money on their research. That's the American way. And so our government tries to find a good way to balance that. And so what they do is they allow a drug company, once they declare that they have a drug that they're going to plan to bring to market, they give them a 20-year protection, a patent protection, to recoup their costs of development, research, marketing, that sort of thing. But once that 20 years goes by, and by the way, that 20 years starts before a lot of the research goes on, or a lot of the clinical trials goes on, is when that 20 years starts. So sometimes it'll take 10 or 15 years to do all that research, and then they're only getting 5 years or 10 years of sales to pay for that. But once that 20 years passes, other drug companies, there's lots of companies that just manufacture generic drugs. They get the formula and they manufacture the drug. They're allowed to then manufacture generic drug, and then the cost for the generics, of course, are going to be much cheaper. But even the brand name drug, those costs go down significantly as well. Not to the same level as generic, but they come down significantly as well to be competitive after that 20 years.
As more competition comes to the market, obviously you start to see prices come down. So that's the question then. Should people be taking generic medication if they find out that it's cheaper than the brand name?
Generally, the answer is yes. Generics, if it's available, I encourage my patients to get the generics. It's a good way to save money, keep their health costs down. But generics are not always available for all medications. A brand new drug, as I mentioned before, it takes 20 years. That won't be available. And they're not the right choice for everyone. You really should have a discussion with your physician about it. There's certain drugs that I have found that the generics don't always work as well as the brand name drugs. One drug is a drug we use for thyroid hormone replacement. It's called Synthroid. In most of my patients, the generic version is just fine, but in some patients, they're taking a certain dose, but their blood values aren't jiving with what they're taking. And it turns out more often than not that that's because they're taking the generic. And for some reason, in these patients, the absorption of the generic version of this drug is different, and so its efficacy is going to be different. So ask your doctor or your pharmacist if the generic is available. Ask your doctor if the generic is equivalent for you as the brand name drug, and if it's not, you want your physician to write in the prescription, do not substitute or dispense as written, and that way the pharmacist won't swap it out for the generic. But generally speaking, the generic brands, the generics are equivalent in efficacy to the brand medications and equally as effective.
That's a good question to ask while you're in there with the doctor, because I always try to think of all the questions that I'm going to ask when I'm there, because I don't want to leave and think, oh, I wish I would have, because I go to the pharmacy and then I'm presented with this question, do I want generic or brand name? So good thing to ask your doctor. That's why we brought the doctor in. Thank you so much, Dr. Ackerman, for being here and your insight and for sponsoring the segment. And Dr. Ackerman, again, he's with us every Friday for questions regarding today's topic, any other health questions that you might have, whatever may be on your mind. Just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.